Going to talk on how to beat the odds of heart disease. Katie Carter received her Bachelor of Science in Nursing from Texas Women's University and became a registered nurse. Katie has spent the majority of her nursing career in the cardiovascular area, first with direct patient care and later at the University of Texas Health Science Center and Clinical Research, while maintaining her Clinical Research Associate certification. She began working in cardiovascular research with interventional cardiac devices and drugs and moved on later to initiate training programs in clinical research, regulatory, and research billing compliance. Katie is working currently with the UT Weatherford Pet Center with Dr. Lance Gould, did I say that correctly? One of the world's top scientists and cardiologists. She works with patients to detect early heart disease with PET imaging and is the research manager for the Century Health Study, a large randomized clinical trial testing 2 treatment strategies for prevention of heart disease. And welcome, Katie.
Lots of information. I hope you'll have a lot of information to take home with you about heart disease. Let's see here. The objectives, I'm talking about the prevalence of heart disease. Going to describe the basic physiology of what heart disease really is. We're going to talk about cardiac risk factors and discuss what we're doing at the Weatherhead Pet Center for reversing and preventing coronary artery disease. The heart, I want to talk a little bit about the heart. It's a very amazing organ. It's about 4 inches wide, about 6 inches long. It beats about 100,000 times a day. So over an 80-year lifespan, we've got the facts up here. It contracts 3.4 billion times. It pumps 61 million gallons of blood. It never rests. It adapts to extreme conditions. When you're ill, your heart is going to keep going. Also, we think about our heart in very many different ways. We think about it as love, strength, coronation, stamina, courage. So the heart's very important, and we really need to be healthy, keep it healthy. It pumps over an 80-year lifespan about 60 million gallons of blood, and that's a lot of blood. That's a lot of work. So we really need to be mindful of our health and keep our hearts in really good shape. Facts about cardiovascular disease in the United States. It's the #1 killer in the United States, and there is about 36% of all deaths are heart disease related. 1 heart attack occurs every 25 seconds, and someone actually dies every 36 seconds of cardiovascular disease. So I've been talking to y'all for about 5 or 6 minutes, so we've lost about 8 people in the United States just since I've been talking. So it affects a lot of people. And interestingly, only 18% of heart attacks are preceded by long-standing symptoms, and typical symptoms are chest tightness or pressure, usually on exertion. Other symptoms can be jaw tightening, back pain in the middle of your back, maybe radiating down your arm, tingling. Those are the classic symptoms of heart disease. And it's something not to let go. Any symptoms, it's best to go check it out with your doctor, because you never know. Sometimes they're vague, sometimes they occur at rest or at stress, so you really don't know, and it's a good thing to check them out. Don't just ignore it. It brings to mind one patient that came in, and I'll be talking about the Century study later on in the presentation, but he came in and joined the study. And he told me that he had been having some jaw tightness, not too bad, but for the past 3 to 4 months, every time he mowed the grass. And it didn't affect him as much. He didn't think that much about it. He didn't even tell his doctor about it. So he came and he joined the study, and we got him enrolled, and he had a PET scan. And sure enough, he had a real critical blockage. If he hadn't been, contacted us, or if we hadn't probed harder, asking questions about his symptoms, who knows what would have happened. So We referred him out to his cardiologist, and he went and had an angioplasty, and I'll talk about that in a minute, and started making some lifestyle changes, and he's doing fine. The prevalence of cardiovascular disease in adults by age and gender. Looking at this graph, you can tell that age 40 to 59 is when it really starts up. Oh, let's see, I'm doing the wrong thing here. Okay, this is when your risk of disease actually doubles in this age group, and at the 60 to 79 age group, 7 out of 10 of us are going to have some sort of cardiovascular disease, and this data includes hypertension, stroke, heart failure, and coronary artery disease. So only 3 out of 10 of us will escape anything like that, and we need to increase that number. This slide shows cardiovascular disease and other major causes of death, and I was really surprised myself because you hear about cancer so much, but cardiovascular disease, you can really see it's almost 1.5 times more cause of death than cancer is, and especially look at the other side over here. Women is a lot higher than the men here, so that's very significant too. And I think women a lot of times don't pay attention or have even more vague symptoms than men do. Looking at spending in health care, we spend an awful lot of money in the United States on health care. So we do have excellent health care. We're about double. We spend almost $7,000 per capita, almost double than the other developed countries. So with all the amount that we spend, we want to know, are we really getting quality health care or getting the most bang for our buck with all the spending we're doing here in the United States? We have high expectations. Expect our providers to cure us. We have the best health care in the world. We have the best resources in the world. We have the best drugs in the world. So we're really expect high things of our health care. But wait, with all of our high expectations and all our resources, let's see what our life expectancy is. Okay. Well, let's see, Japan is tops, and their life expectancy is 82 and almost 83 years. We've got Australia at 81, Italy 81, France 80, Spain 80. Where's the United States? The UK 77, almost 78 years, Germany, and we go on down the list. And here we've got the United States at 77. So, this just doesn't make sense. We're spending so much on health care, but our life expectancy is not where it should be. At best, we're average. So we need to take a look at that and see what we can do to make that better. With all our spending, let's see. This study shows that lifestyle is a huge influence on cardiovascular disease and cholesterol levels. And they looked at some Japanese people living in Japan, and cholesterol was under control. Oops. Here we go. 181 is under control. They have a low cardiovascular disease rate. If they moved to Hawaii, their cholesterol started going up, and so with their disease rate. And gosh, if they move to San Francisco, they're in big trouble. They've got high cholesterol, and they've got a really increased of mortality there. So you can really see that lifestyle makes a huge effect on cardiovascular disease. Okay, how do we fight coronary artery disease? The standard treatment is the cascade. You may have had some symptoms, and you go in to see your doctor, and he assesses you and thinks that it could be cardiac related. So he recommends that you have a non-invasive test. Maybe a nuclear stress test or maybe a PET scan of the heart. So you undergo the testing and it comes out, shows that there may be a problem. So your doctor recommends an angiogram, and that's where they go in and through an artery, maybe the femoral artery in your groin or the radial artery in your wrist, and they look to see, they can measure the blockage there and determine if it requires a stent to open this narrowing, and I'll go into that in just a minute. Then they would recommend revascularization, which means either a stent placement, balloon angioplasty, or bypass surgery. This diagram shows what happens during angioplasty and a stent placement. And over here, oops, I keep getting the pointer mixed up. This is your artery, like it's laid out on a table and sliced open. And you can see the lumen here where the blood's coming through. These are branches that go off that coronary artery. And this yellow on the sides here is this thick, fatty plaque, cholesterol plaque that's built up over time. And it can build up and cause a narrowing, so the blood is not getting all the way down to supply the rest of the heart muscle, and that would cause your chest discomfort, a little pressure. So the cardiologist goes in with a catheter, and it has a tiny little balloon and possibly a stent on the end of the catheter, and they inflate it to several atmospheres, and it compresses this flat, fatty plaque back against the wall of the vessel, thus opening your blood flow here, so you're getting ample blood flow down to supply the heart muscle. So that's one type of revascularization. The other one is bypass surgery, and similar, you have a narrowing here with caused by the buildup of the fatty plaque, and the surgeon usually harvests a vein from your leg and attaches it to the aorta. It comes around and attaches below the level of the blockage in the heart artery, so it just bypasses this narrowing, and the blood flow is adequate down here to supply the rest of your heart. So that's elementary about what a bypass surgery is. Okay, let's see why it doesn't work. This is William Osler. He was a Canadian physician, and he was one of the founders of Johns Hopkins Hospital. He said, he had a lot of quotes, and this one was, "The good physician treats the disease, the great physician treats the patient who has the disease." He's often called the father of modern medicine, so let's see what he meant by that. Okay, why angioplasty and heart surgery do not prevent most heart attacks or death. Here we have the same vessel over here, the sliced section, and you can see the diffuse cholesterol. If you take a cross section right here, you can see that this is the blood flow in the lumen of the vessel, and the gray is the walls of the vessel. And you've got this yellow, soft, fatty cholesterol plaque here. There's a lot of inflammation going on within this plaque, and it causes this thin membrane that keeps the blood separate from the plaque to get weakened and stiff. And with the sheer force of your heart pumping the blood through the vessel, it further weakens this membrane, and it eventually breaks. It's called a plaque rupture, and the fatty plaque mixes with the blood and causes a blood clot. The clot stops the blood from moving down the end of the artery, and that causes a heart attack. So what the goal is to stabilize this fatty plaque and reverse, get rid of this fatty plaque and stabilize your artery, so you'll have good blood flow all the way down. Okay, this is just a little silly, why we do it. Walter Matthau. He was cute. He was very cute. Okay, so the current evidence, intensive low-density lipoprotein lowering, the LDL, and that is the bad cholesterol, with statin therapy may induce plaque regression, further decreasing cardiovascular events. The statin drugs lower your risk of heart disease and stroke by 30 to 40%. And other drugs, like antihypertensive or other cardiac drugs, lower your risk by about 10 to 15%. So we can get some lowering, but you still have the coronary artery disease. You still have the fatty plaque, so it doesn't help reduce that. Can we do any better? We're always looking for the silver bullet. We're looking for pills to take. We're looking for new pills, new drugs to targets, new ways of delivering drugs. We have nanotechnology, we have stem cell therapy, we have genetic therapy. We're looking at everything. We're so programmed. We have the attitude to ask for another drug or procedure to fix our health problems. But we need to think of another way. Also, cost. There's a new drug that just was approved this summer. It's a cholesterol-lowering injectable drug called the PCSK9 inhibitor. And it's hopefully going to revolutionize cholesterol lowering. But it's only approved to be used in certain situations for certain patients. But it costs $14,000 a year, so the costs are tremendous of these new drugs. Are we missing anything? Do we need a different approach? Okay, lifestyle. Is there anything we can change? This poor guy's going in and let me put it this way, for your weight, you should be 37 feet tall. Is there anything we can change about our lifestyle? Bad family history? Don't blame your genes. About 90% of family history is modifiable behavior. 10% is genetic. So family history really isn't a good excuse, but it's what we've learned growing up, our lifestyle, our exercise habits, our eating habits. It just tends to run in families, and we're doing our best to try to help change things like that. Okay, it may not always be easy. This poor guy, had 2 weeks of jogging, and so far he's only made the front door. But exercise is really worth it. This study showed that active people reduce their risk of cardiovascular death by 50%. So it's very worth it. Why should we exercise? It's going to reduce our risk for heart disease, decreases our mortality by 45 to 50%. And by exercising 2.5 hours a week, and you can divide it up into 30-minute segments, 30 minutes a day, or you can do 15 minutes in the morning, 15 in the afternoon, but it really makes a huge difference. It'll decrease our mortality. Any kind of exercise is good. Find something you enjoy. A lot of people just enjoy walking. A lot of people enjoy classes, but it's so important to make that a part of your habit and make that a part of your day. Okay, this is the standard American diet. Sad. Dr. Stefano Stringola is one of the cardiologists working with us, and he's from Perugia, Italy, and grew up with the Mediterranean diet. And he went to the rodeo, and he came back and he said, "You won't believe what they're eating out there." And he was just amazed and dumbfounded by all the people standing in line waiting to get this fried whatever, Twinkies, key lime pie. But the epitome, in his opinion, was the ultimate donut bacon cheese hamburger. It has 2 glazed donuts on either side, like the bun. Now, I've never seen this. But anyway, he said, we have got to do that. It's okay maybe once a year, but I'll show you why it's really bad, the dangers of having a fatty meal. When you take your cholesterol-lowering drugs, your statins, it gets you at a steady state here. Oh, I did it again. Up here. Your blood levels of cholesterol and triglycerides stay low, about a 50% decrease to cardiac event. But when you eat a fatty meal, it's called the lipid surge, and you reduce you increase your risk of cardiac event. The fatty food increases the cholesterol and triglycerides in your bloodstream for about 8 hours. So you're really not protected with your statin at that time. So if in the morning you have a good country breakfast, you know, sausage and eggs and sweet roll or waffles and all that good old stuff, then you have the lipid surge for about 8 hours. Then you're rushing around and you go to Whataburger and you get a hamburger and fries for lunch. Your cholesterol levels stay up further. And then at dinner you meet some friends or meet your husband or spouse at the steakhouse, and you have a nice big salad and a steak and a baked potato. You're really, your statins are not going to help you at all because of this lipid surge. Your cholesterol is going to stay elevated. Okay, so we're talking about a healthy diet. We're teaching a healthy diet to all of our patients, and I know y'all know this. We all have heard this, but we recommend unlimited non-starchy vegetables, salads, fresh vegetables, cooked vegetables, to be the main bulk of your diet. High protein, lean protein, chicken, fish, with the skin off the chicken. Lean pork tenders are good, have less fat. We really recommend limiting your red meat because of the fat involved in that. Let's see. The next is fruit. Fruit has a lot of sugar in it, but we recommend 2 to 3 servings of fruit a day. Unless you're diabetic, we might reduce that a little bit to avoid the blood sugar elevation. And then breads, potatoes, rice, and pasta down here, really limit those. It has a lot of sugar in it. It causes you to hold on to your weight. We've had a lot of patients that have really tried to cut that out, and it's a huge difference with their exercise. They've really dropped the weight, and once you get the weight off to your goal, then you can start gradually adding some whole grain foods such as that in. And then really very sparingly fat. We recommend 20 grams of fat a day, and this friend of mine, David, talked about Dr. Gould. He said, is he the one that recommends the cardboard diet? And it's really no fat diet, really a low fat to reduce your risk of heart disease. Dr. Lance Gould is a scientist. He's an innovator. He's a professor of cardiovascular medicine as well as a compassionate physician to all of his patients. Research studying cardiac blood flow is internationally recognized. This is the Journal of American College of Cardiology with his research on the front. And I'm going to talk about the PET scans in just a minute. He's shown that PET imaging is a valuable non-invasive tool for determining whether or not a revascularization is necessary with a stent. We get a lot of patients that come to us for second opinions that may have had a positive nuclear stress test, and they want a very diagnostic and accurate tool to see if indeed do they need to go and have an invasive angiogram. His research has also proven that diet and exercise along with appropriate medications can stabilize and potentially reverse heart disease. He's using the cardiac PET scan to measure absolute coronary blood flow, and he's absolutely the expert in the world with coronary blood flow. So this is slide again where our goal is stabilizing the plaque. Here's you've got your cholesterol fatty plaque streaks here, right here. We don't want to go this way. We want to reverse the coronary artery disease, reduce the fatty plaque to a stabilization of the vessel by reversal treatment. And it is possible with a diet and exercise and appropriate medications. PET scan. PET means positron emission tomography. And I remember when a group of us went, our office is at Memorial Hermann Hospital, and we're certified advanced cardiac life support every year, and a group of us went to get certified through the Life Flight office. And we said, we're from the PET Center. And they thought, well, y'all are working with animals down there. And so no, but it is positron emission tomography. And it's very, it's extremely accurate, and it's a powerful motivational tool. This is how the images come out. And this is, we do a resting scan first, and then we do a stress scan. It's a chemical stress, and use a drug called dipyridamole. And this drug dilates your blood vessels. It's a vasodilator, so more blood comes into your heart, and your heart has to beat faster to pump it out. And this scan is totally normal. It's a good red color with a little bit of yellow. It's totally, this is a healthy heart. And I'll show you some next that are not so healthy. This shows a localized stenosis, meaning it's a non-critical, definite narrowing of some heart arteries on this side. This patient came in and had a fairly normal PET scan image of his heart, and then a year or two later he came back and had another scan, and you can see the green and the blue here indicating that he had a progression of a blockage there in his heart. This patient came in for his first scan, and he had this bad non-critical, but it was a definite narrowing, the decreased blood flow area in one of his arteries. He came back a couple of years later after lifestyle diet modification, and here's his scan where this blue has regressed. So this man did a great job. Diffuse disease. Diffuse means it's kind of all over, mild, non-obstructive disease, so it's not localized in any one area. And this patient had a normal PET scan when he first came in, and as we followed him, he didn't follow the guidelines like he should have, but his PET scan got a little bit worse, so he had some more diffuse things going on, so we really needed to work with him. This patient over here came in, and his PET scan showed was not totally normal, but with lifestyle modification and medications, his is normal now. So this is how the PET scan images show up. Okay, the last thing I want to talk about is the Century study. We've been started this study several years ago. And it's a randomized trial of cardiovascular disease management by PET imaging of the heart, medications to goals, and encouraging a healthy lifestyle. We're trying to minimize and eliminate your risk factors for heart disease to reduce cardiac events. The Century is an ongoing study. Our target is 1,300 participants. We have about 1,000 in the study right now, and we follow everyone for 5 years. When you come in, you're randomized to one of two groups, optimal standard of care, and that's our control group, and the other group is our comprehensive risk factor management group. So when you think of a clinical trial, normally you think of experimental drugs and devices. Everything that we use as part of the study is already FDA approved. So there's no experimental drugs or devices. Our experiment is a management strategy. So we work with the comprehensive group more frequently than we see the standard of care. The standard of care group follows up like you would follow up with your own doctor. All participants, regardless of your group assignment, consult with the study team at every visit. And all the Century patients will receive risk factor assessment and consultation. They get electrocardiograms periodically and exercise stress tests. We use the exercise stress test to measure your fitness level, how active you are. We do blood tests for cholesterol, liver, and kidney function. If you're diabetic, we do hemoglobin A1C with that, and also a high sensitivity C-reactive protein, which is a measure of inflammation, could be a predictor of heart disease. We do 3 scheduled PET scans at the first visit, 2 years and 5 years. And those are studies like I've shown you of the heart blood flow. You meet with a dietitian every time you come for a diet evaluation and consultation, and we assess your exercise level at every visit and talk about your risk factors with a cardiologist. We have 4 cardiologists, 3 cardiac nurses, and 3 dietitians on board with the study. And all of this is a service in addition to what your doctor's already managing. It's not an alternative. We want you to continue with your own doctor, and it's like an added-on risk factor management service to what he's already doing for you. Can you participate in the study? We really are looking for more participants. We're trying to get to 1,300, and when we follow you for 5 years. So the people that we're interested in are those who have had a heart event, maybe a previous heart attack, or have had a stent placement or bypass surgery, or maybe they've had an abnormal stress test and they're managing it medically, or those with risk factors for heart artery disease. That includes diabetes and multiple other risk factors, and I've got a list of those here. Traditional risk factors for heart disease is over the age of 50. Family history of heart disease, and more significant is those immediate family members who are under the age of 60 when they were diagnosed with some problem. High total or LDL cholesterol or treated for cholesterol. High blood pressure, and the new guidelines came out recently that now 130, the systolic of 130 is top, so we were looking at lowering below the 130s now. Low HDL cholesterol, and that's the good cholesterol, so we want ideally to have your good cholesterol elevated, so we're looking at men with HDL below 40 and women below 45 HDL. Also diabetes, that's a real risk factor for heart disease, cigarette smoking, of course, and coronary calcification. And a lot of times you don't know that you have coronary calcification, and that's the atherosclerosis or hardening of the arteries, that calcified plaque that's been there a long time. But sometimes people will come in and say, gosh, I had a CAT scan for something and they told me I have calcification in my heart artery, so it was an incidental finding, and but that is a risk factor for heart disease as well. So a final take-home message for atherosclerosis prevention: heart disease is a disease that you do not have to have. It's 90% preventable in most cases. Don't wait for symptoms or an abnormal stress test. If you have any symptoms at all, like I mentioned before, go to your doctor and check it out. It's just not worth it to wait. Don't expect others to do it for you. It takes a lot of hard work. So you've got to really get a mindset that you're helping your body. You're going to keep yourself out of the hospital, reduce costs. You've just got to do a little elbow grease and have a little willpower. We have to treat the patient who has the disease, not just the stenosis. And I've had lots of people tell me, oh gosh, thank goodness we got a stent, and that fixed it. Well, it didn't really fix it. It just fixed the immediate problem, but you still have the disease that will flare up if you don't work on it. And the silver bullet to win the battle against the #1 killer in the U.S. is in risk factor modification by informed, supported, and motivated people. And that's what we're trying to do with our patients, give them the education and the knowledge to make healthy lifestyle decisions. Dr. Gould said when we were starting the study, in a sense this study is mainstream, but in another sense it's also 10 years ahead of its time. But its time 10 years from now becomes today. And he said that about 6 years ago. So, anyway, that's the end of my talk, and I really appreciate y'all coming out.